On this edition of Veterans Health Watch, we'll learn about the VA Maryland healthcare system services for long-term care for hospitalized veterans so they can maintain optimal living and independence.
We'll also learn about community-based services and the home-based primary care services, which we offer to veterans as they age through life.
Welcome to Veterans Health Watch, a program sponsored by the Veteran Affairs Maryland Healthcare System that brings you the latest health and benefits information to Maryland's veterans, family members, and the local community. I'm Michael Rubin.
And I'm Dr. Lois Freeman. The U.S. aging population is rapidly expanding, and the U.S. Census Bureau estimates that by the year 2030, the aging population will reach 69 million, 20% of the U.S. population. Joining us today is Dr. Abisola Messiyoye. She is the director of the Geriatrics and Center Care Center at the VA Maryland Healthcare Center. Doctor, thank you for joining us today.
Thank you so much for having me. And please call me Dr. Abby. That's what most people call me.
Okay. Dr. Abby, could you give us just an overview of what this medical specialty of geriatrics is, and what does it mean and offer our veterans in the VA Maryland healthcare system?
Certainly. As you said, the American population is aging rapidly. That makes geriatrics really crucial for the veterans of this age. Between 2000 and 2010, the number of veterans over 85 has almost tripled, and we really need specialists to be able to focus on providing excellent care to these people. Geriatrics is actually one of the subspecialties of internal medicine. We focus on care of the elderly, improving their quality of life, promoting independence and function. We also are the last doctors for our patients much of the time, and we then help them to transition to a peaceful death with comfort and dignity, supporting them and their families.
Dr. Abby.
Yes, sir.
What type of approach is the VA Maryland healthcare system using in treating the complex healthcare needs of our veterans as they age?
So in the VA Maryland healthcare system, we have several geriatric teams at different sites. We have both outpatient and inpatient and community and home. What we do in geriatrics, which is sort of different from standard internal medicine, is that we concentrate on every part of the elder, his physical being, his social being, and mental being. So we use an interdisciplinary team approach. Every member of the team is important and conducts a comprehensive examination of the veteran in order to help them to reach their goals.
Dr. Abby, could you explain to us further what extended care means?
We say extended care because we want to care for our veterans every moment of their day. So the traditional model is that you come, you see a doctor, the doctor sees you, and that's it. You are in the hospital, you are discharged, that's it. But in geriatrics, we want to know about you when you are at home. How do you eat? How do you drink? Who does your shopping for you? Who does your laundry? So extended care encompasses all the services that are needed to keep an elder functioning the best they can be in their own home.
I've heard, Dr. Abby, a term called rebalancing. How is the VA moving towards rebalancing, utilizing this model of care with our veterans as they get older?
So we say rebalancing because traditionally, a lot of elderly people were cared for in institutions. But what we want to do is to improve the quality of care and promote their independence. We want to move them away from institutions to home and the community, where they can be with their loved ones and friends. So in order to do this, we are focusing more on community and home-based programs rather than concentrating on keeping people in hospitals and nursing homes.
And Dr. Abby, so we know over the last several years that the VA has changed its model of care and transformed what's traditionally done in the home more toward what's going on inside the VA. Can you expound on that for us a little bit more?
So in the VA, we used to have nursing homes. Now we have community living centers. And they provide a wide array of services geared to help people to transition to the least restrictive setting, which in most cases will be home. So in the community living centers or CLCs, we have different services. We provide skilled nursing, skilled rehab, short stay rehab, and also hospice care. We have both inpatient and outpatient hospice because hospice remains an integral part of geriatrics.
Sounds like we're doing a lot to keep the veterans out of the community and offering more services in the facility.
Yes, and the vision of GEC, Geriatrics and Extended Care, is to make the last months or years of a person's life truly remarkable, truly golden. As you know, elderly people have a lot of disabilities because of the way people age. The same body you had when you were born is not the body that you die with. People become more disabled, they become more frail. My role is to make those last years or months or days golden, for you to have an opportunity to enjoy your life, maintain the best health possible, despite your limitations. And when it's time for you to leave this world, to transition you in a way that is dignified and supportive for both you and your family. And that is geriatrics.
Thank you.
Dr. Abby, you've presented some very interesting and innovative ideas in long-term care and how we can help our veterans regain their quality of life and maintain their independence. What is the eligibility process for these veterans?
So we try to provide our care to as many veterans as possible. However, there are some veterans that we are mandated to provide this care to. And those are people who have not only served their country, but developed service-related disabilities as a result. So if your reason for extended care is related to your service-connected disability, we are mandated to care for you. Also, if you have a service connection of 70% or more, or you are 60% and totally disabled and considered to be unemployable, veterans in that category will also qualify for indefinite stay in one of our community living centers if they need to.
Okay, Dr. Abby, can you tell us what factors do you use to determine how long a veteran might stay in one of our facilities?
So again, geriatrics is a very individualized specialty. People age differently, depending on genetics, depending on their activities when they were younger. And unfortunately, the brain, the GI, the other systems, they don't age in order. So depending on how you age, your presentation at the end of your life may be completely different. So for every person, we set goals. We will sit down with you, find out what is important to you and what is important to us, and then we combine together to develop an individualized care plan for you. When you have met the goals of care, that is when we start to look at discharge. And we will help our veterans to transition to the best environment for them.
That's very interesting. In the time that we have remaining, how are veterans referred to the program?
We have a long-term care screening coordinator. Her name is Kelly Grand. And if you call her, she will help you with the process. Social workers in any department can also access geriatric and extended care programs by putting in a consult through our electronic medical record system.
We're going to take a short break. So is there anything else that you'd like to tell our viewing audience about the long-term care facility?
I would say that we have a large number of very dedicated, competent, passionate individuals whose mission is to provide you the care that you deserve for your service to our country. Please contact us if you need to to learn about any of our programs.
Thank you so much.
Thank you.
Dr. Abby, it was a pleasure having you with us today. I am sure that our veterans in the community have gained valuable insight into the programs that we offer. We're going to take a quick break, and when we return, we'll be talking with a representative from the VA Community Care Program, so stay tuned.
There are numerous benefits for a veteran to enroll in the VA Maryland healthcare system. Number one, they get excellent health care. There's a great pharmaceutical service. They have specialists in all of the areas and use cutting-edge technology. And we have a very good electronic medical health record.
You can keep your current provider as well as come to the VA.
For our veterans, no matter whether they live in Central Maryland or Eastern Maryland, our clinics are conveniently located to where they live throughout Baltimore and the Eastern Shore.
The fact that there are other veterans here that I can talk to and share common experiences with.
The amount of medical attention that I received has been excellent.
The VA Maryland healthcare system is your VA. It's America's VA. It's the veterans' VA.
Since I've enrolled at the VA, it has been a great decision, and I encourage every veteran to enroll. They will not regret it.
Did you know that Department of Veterans Affairs provides physical and mental health care for over 8 million veterans? Hi, I'm Natalie Dell. I may be an Olympic medal winner, but I know that real champions are those who have served this country, and VA knows that too. As a VA employee, I've seen the challenges our veterans face. I'm honored to be part of a team that supports veterans in achieving fuller, richer lives, and I invite you to join us in this rewarding experience. If you're a mental health provider, I urge you to visit vacareers.va.gov.
Welcome back to Veterans Health Watch. Joining us now to learn more about the VA Maryland healthcare system's community long-term care programs is Ms. Crystal Taylor, who is the lead social worker, make sure I have this right, lead social worker for the Geriatric and Extended Care Clinical Center.
Yes, you do have it correct.
Welcome.
Thank you.
Crystal, in our first segment, we learned about long-term care services available to veterans in the Maryland healthcare system that are hospitalized. Could you talk to us and kind of shift our focus to services that are available in the community to our veterans?
Sure. The whole premise of the community care programs is to assist veterans to remain in their community, home, or settings, and also to give them some choices about the programs they'd like to participate in.
Crystal, I understand that there are many programs offered by in the community by the VA Maryland Healthcare's Geriatric and Community Living Center. Can you expound on those programs and tell us something about them?
Sure. We have a multitude of programs that we're offering. One of the programs is respite care. And earlier, Dr. Meshioe talked about respite in the community living centers. We provide respite care, which are a temporary relief to families or caregivers for veterans, where they're able to have a community agency that we contract with provide services to the veteran, and the family member or caregiver gets a little bit of a break, and that is for 30 days.
This program sounds like it's geared toward providing veterans and their caregivers with more access, choice, and control over their long-term healthcare services. Are there any other programs available to veterans that help maintain them in their home longer?
Yes, we have contracted nursing homes that the VA establishes a contract with community nursing homes where the veterans can go and remain there close to their families, and they're either able to stay there indefinitely or on a temporary basis. We also have community residential care program where veterans need supervision, but they are somewhat independent. And we, the VA, contract with licensed homes that we approve, and we give the veteran supported services in the community. We have medical foster home, where we work with licensed homes again. We go into the community, seek them. The veterans can stay with a caregiver They're nursing home level veterans, but they prefer to be in a community setting with less restrictions. They can serve 1 to 3 veterans in these homes, and the veteran pays for the care themselves. We also have adult day centers, and the veterans are able to go to the adult day centers 2 days a week, and the VA will compensate the center for their care, and their family members are able to take care of things while the veteran's receiving that care.
Crystal, what is the latest, greatest program to roll off the shelf?
One of our newest programs is Veteran Directed Care Program, and this program is really great because veterans do decide what type of care they want. We are working with the local Department of Aging, and we work in conjunction with them to provide veterans the care. So veterans can hire who they would like, whether it's friends, family, neighbor, etc. They work with the local Department of Aging and they direct their care. So they get a budget for the month, they decide what type of care they need, and it's really great because the veterans are in control of their care.
Sounds like that is fitting right in with our new motto of transformative care, patient-centered care.
Yes, lots of the veterans enjoy it. We're working, each county will eventually have it. It's very new, so we only have a few counties that have it, but I get many calls about veteran-directed care, and the veterans really do seem to enjoy it so far.
And how would they access this new service?
Again, this is another program. You have to talk to your primary care physician, let them know that you would really like to work in this program. You want to make sure that you get to hire who you want. And then the referral would be put in and they could begin if it's in their county.
Wonderful.
Mm-hmm. And what about home health aides? Do we offer home health aides?
Yes, we do. We have home health aides is one of our most popular programs. And this service is for veterans that are predominantly homebound. They would like someone, the family or the veteran would like care where they're provided bathing, assistance with their bathing or dressing or toileting or etc. And we have contracts with agencies that provide that care for the veterans.
Okay. Could you give us a little bit of information about who is eligible to receive these services?
All veterans that are enrolled with the VA are eligible to receive the services. The criteria depends on the different program. The veterans would see their primary care provider and they would discuss what their particular care needs are, and then the provider would make the appropriate referrals to the program for the veterans.
Can a veteran receive more than one of these services at the same time?
Absolutely. We have many veterans getting multiple programs at the same time. It really depends on what their particular care needs are.
Okay. And can you tell us, how would a veteran be referred to your programs?
Sure. The veteran would come in and see their primary care provider. The veteran and or family member would discuss what the veteran's needs are to remain in the community, and the provider would then make the referral to any of the programs that we've discussed a little earlier.
If a veteran or their family member wanted to learn more about any of these services and programs that you've presented today, is there a phone number or a website they can go to?
Sure. The veterans or their families could always go to the VA website, which gives a description of each of the programs, and they could also call our community care office.
Well, we've learned a lot, but we're getting ready to go to a short break. Is there anything else that you'd like for our viewing audience to know?
Yes, I would always like veterans to understand that they must see their care providers once a year to make sure that they're eligible, and understand that there are co-pays and financial responsibilities with some of the programs.
Thank you so much for joining us today. And when we return, we'll talk more about VA home-based primary care program services. Stay tuned.
The telephone care line is available 24 hours a day, 7 days a week.
If you've got a question about medication, diabetes, your diagnosis, any concerns, you can always give us a call. People want to hear a live voice and not the machine. We're always there to answer your questions. Give us a call.
800-865-2441 and press 1 to speak to a nurse. 24 hours a day, 7 days a week. A nurse is happy to help you.
Our veterans put everything on the line to protect our freedom. We may never be able to repay them for their sacrifice, but we can show them just how much we appreciate all they've done. Every day, hundreds of people just like you volunteer to help our veterans. You can help by simply sharing your time, lending a warm smile, a supportive hand, or a sympathetic ear to someone who needs it. Everyone can do something to make our veterans know how much we appreciate their service. What will you do?
Welcome back to Veterans Health Watch. Joining us now to talk more about the VA home-based primary care program designed to extend long-term care services is Lenitris Williams, who is the program manager for the home-based primary care. Welcome.
Thank you, Michael.
Lenitris, can you please describe the home-based primary care program to our audience?
Yes. Home-based primary care has been in existence for 32 years. It has actually been established at our VA since 1983. We provide services to homebound veterans who can't actually come out to the clinic because of various issues that they may have, be it physical, mental, or psychological.
Okay, thank you. And Lenitris, could you just go a little further and expound upon the individual services that are available to the veterans through home-based primary care?
Home-based primary care not only provides primary care in the home to our veterans, we also provide palliative care, which means comfort care. We provide outpatient hospice for those people who may have veterans that are dying. We also provide rehabilitative services for people who may require rehab at home. So we not only provide an individual approach, we provide a team approach for the veteran.
So let me clarify also, are there mental health services, telehealth services, or other services that are also available to veterans who are in home-based primary care?
Yes, actually we do have mental health. We also do have telehealth. It's an entire interdisciplinary PAC team. So there's a social worker, there's a dietitian, there's mental health providers, there's also a kinesiotherapist or a rehab therapist that can help with rehabilitative needs. We work in partnership with hospice in case that is a need that the veteran may require. And then we also have external contracts with vendors providing skilled nursing care for things such as Foley's, dressing changes, infusion, if that's something that the veteran requires. We also have contracts with vendors where we can also provide rehabilitative services such as occupational therapy, physical therapy, and speech if that's something that they require.
Okay, so it just sounds like the only difference is that this veteran cannot physically come into the medical center for services.
Absolutely. We provide access to the veterans for the VA services. So it's another option for them, especially if they feel that they cannot make it in the inpatient or outpatient setting. The goal is to keep the veteran in the community where they actually belong.
That's good. And so that just increases their access to care.
Yes, it does.
Okay, thank you.
So it sounds like the homebound veteran is the most appropriate population that would benefit from your services, or are there other?
Yes, there are other people that can benefit from our service. One of the criteria indicates that the person should be homebound, but if the person is a frail or chronically ill veteran who just for some reason can't come to the office because of the need of a caregiver to come, or they need a specific device, we would definitely consider them as an appropriate candidate for the program.
Okay. Lenitris, can you provide our viewing audience with a definition, or what is the difference between longitudinal and episodic care?
Yes. Longitudinal care means that we provide care to the veteran over the continuum of their life. So whatever point that they enter our program, we're with them until they no longer require our services or until they die. We also, episodic would mean that they would come into the clinic just for one issue or two issues. We have an entire PAC team that tailors a care plan for the individual to take care of all of their needs, meaning that we take care of not only their primary care, we take care of psychological, social, dietary, or rehabilitative needs.
Okay. And let me just ask you, since you mentioned specialty care, because a veteran is on home-based primary care, does that mean that they don't have access to our specialty clinics? How is that handled?
They absolutely have access to our specialty clinics. Our nurse practitioners would actually write a referral or a consult for the veteran to be able to have any specialty they need, be it endocrinologist, rheumatologist, whatever the need may be.
Okay, thank you so much.
So now I'm sure the question that's on most people's minds is how are they referred to this truly exciting veteran-centric program?
The interesting thing about that question is that anyone can refer a veteran to our program. They could be referred by their doctor, a friend, a family member, a neighbor who thinks that they need care. The only thing that's required if it's someone that's not a medical person is that it is approved by a primary care provider. If they're inpatient or in the VA, they have to do an appropriate consult through the system.
Okay. Now, I think that most veterans would have a question about how to get into the program or how to get to the VA. Can you talk a little bit about that?
They just have to give us a call. They can refer themselves. They can be referred by a family member, neighbor. They just have to give us a call or visit our website.
In the time that we have remaining, are there any other services that are available to veterans through this program?
Yes, as I mentioned earlier, we have purchase skill care, which allows the veteran to have access to rehabilitative needs such as occupational therapy, speech therapy, or physical therapy. It also gives them an opportunity to receive services such as dressing changes, tracheostomies, wound care. So the whole gamut, we make sure that they can get any service that they need.
And what is the veteran service area?
Home-based primary care services veterans in several areas. We have Baltimore City, Baltimore County, Hartford, Howard, Carroll, Anne Arundel, and Cecil counties. We currently have 400 veterans enrolled, and our goal is to expand to the Eastern Shore within the next 1 to 2 years.
Wonderful.
Can you tell us, Lynn Atrius, how a veteran or the veteran's family member can get more information on home-based primary care services?
Yes. To get more information on our services, you can give us a call at 410-605-7620. You may visit us on our website.
Lynn Atrius, thank you so much for taking your time to talk to us about this valuable VA program. We really appreciate it. And that wraps up this edition of Veterans Health Watch. If you have any questions or have suggestions for future topics for our show, please don't hesitate to contact us at 1-800-463-6295, extension 7101. Or you can check us out on the web at maryland.va.gov. Or, of course, you always can follow us on Twitter or Facebook.
If you are a veteran or know of a veteran who has not enrolled in VA health care, please visit your local VA or call 1-800-463-6295, extension 7324. Visit your local VA or enroll online. We look forward to hearing from you and see you next time.
The VA Maryland healthcare system has 3 main campuses where we deliver medical care.
And also 6 outpatient clinics, which are conveniently located around Central and Eastern Maryland.
All these facilities provide a broad array of services: primary care, comprehensive mental health care services, audiology services, optometry services, podiatry services.
And at our main medical centers, we have a full array of medical services to offer all veterans.
Come visit us at any one of our locations. We look forward to serving you.